let's make a start. Thank you, Erin. So a really warm welcome to everyone that's able to join on a Thursday afternoon. I know you're probably giving up your own sort of time. So thank you ever so much. And I do hope you enjoy this. A big thanks and a really big thanks to Adam, our dietitian from Nel's team, who has definitely taken time out of his working hours and probably doing this his own time. Adam, so thank you ever so much for supporting this event. And this event really came about from some of the feedback that I've been having in the pathways that I've been sort of rolling out as part of UCLP and proactive care pathway, the real need to understand a bit more about diet. Obviously, we'll never get as good as Adam, but at least if we have, you know, some basic understanding of how and what to say to a patient, and that's why in my first slide I've got good, bad, or ugly. Then that's at least a starting point, and then at least we can signpost patients to the right direction. So thanks ever so much, and I hope you have a good session. So in my style, for those people that have attended, in my style, you know, I love posing questions and quizzes. So I'm going to start off with just a self-assessment quiz. I'm going to show you some food types. You just put down in your little notepads whether it's good, bad, or ugly. And I'm not going to define good, bad, or ugly. It's just what the perception is and what you think the foods are. I think I've got the spelling of falafel probably wrong, so do apologize there. It probably should be just one F there. Here we are. It's a falafel wrap. So it's in a type of bread with falafels and some salads. So good, bad, ugly. Just make a note of it. If you feel you want to put it in the chat function, Mahi, I know you love contributing and you are extremely interactive. So if you prefer to put down, then just put down. Okay. Next one, fish and chips. Oh gosh, this is, thank God it's not after 1 o'clock time, isn't it? I would not be able to run this session. The fish and chips, okay. Yeah, okay. Grilled fish. That does look yummy, doesn't it? Yeah. I've got some basmati rice with vegetables. Okay. Erin, if you just slow down slightly on the changing of the slides, that's okay. We've got chicken biryani, and just remember chicken biryani, we've obviously got the chicken, we've got lots of vegetables. There looks like some sort of fried onions on top, some nuts maybe bits of vegetables. So yeah, good, bad, ugly. Okay. Next one, jacket potatoes. You can see you've got a bit of cheese on top, maybe something else on top. Yep. Okay. Good, bad, ugly again. Brilliant, guys. Thank you. I think this is a favorite for Jamaican, isn't it? This is curry goat with rice peas. I think there might be some mashed potato on the side, or maybe, and some vegetables. Good, bad, ugly. Okay. You've got lots of bads there. All right. Brilliant. Next line. Oh, that looks yummy, actually. Noodles. So you got noodles with a bit of meat, vegetables. Yep, good, bad, ugly. Yeah, we'll come back to that. Erin, if you just slow down a bit, I'm just waiting for people to just digest the food, literally, visually. Okay. We got sushi. Again, I'm not a fan of sushi, but that does look lovely, doesn't it? Okay, next slide, please, Erin. Good, but no rice. Okay, Todd. Right, I am actually not sure if this is Japanese as well. It's got some sticky rice. We've got some fish there, some vegetables and noodles, some pickle maybe, or salad, bit of mushrooms, I think it looks like. Good, bad, ugly. Yeah, without the rice, good, Todd. Okay. All right, next slide, please, Erin. Oh, now that is just amazing, isn't it? I should have put down an option really of I don't really care. It looks lovely, but this is Thai red curry. Yeah, it's got vegetables. It looks like prawns and that lovely creamy curry. Okay. All right. Exactly, Ella. Nice. Next one, please. Vegan salad. I'm sure people will get that one. Good, but not enough, isn't it? You always need that as as a side dish with something else. Okay, brilliant. Excellent. We will come back to these slides and we're going to take Adam's take on it later on. So this is kebab, which is grilled kebab with rice. And I don't know, it looks like a dollop of butter on it or what?
No, yes, I could take this.
With tomato.
So I could.
If people could mute themselves, it'd be really helpful. I think I can hear some background noise, please. Okay, right. Good, bad, ugly. Right, brilliant. Next one, please, Erin. Oh, I love these banana chips, and they're in various forms and shapes, and actually eaten, you know, the world over. We are talking about world food here. The good, bad, ugly. Tasty. Okay, right. Right, this is a favorite of South Indians, actually. It's called a dosa. It's like a pancake, and it's eaten with all these other bits and pieces. One of my favorite South Indian dishes. Yeah, okay. And I agree, it is absolutely scrumptious. Yeah. Okay, next one, please. That's a pie. And I believe that's Albanian. And I'm actually not sure what's inside, but it's a pie. Okay, good, bad, ugly. Great. Other you've given it 2 goods. Your favorite must be pies. Next one, please, Erin. That's a pizza. And it's got a pizza with some topping. Looks like, I don't know if it looks like avocado. Definitely got some cheese and some leaves. Maybe just leaves, maybe spinach. Yeah. Thought avocado is good in terms of the cholesterol, but sometimes it's got high calories, and we'll speak to Adam about that. Okay, next one, please. Yeah, G might be basil, yeah. Just soups. Now I'm going to take a guess. One's tomato, one looks like spinach, one looks like butter squash, and the other maybe carrot. So which one is good? Or all of them? Good, bad, ugly? Yep. Almost coming to the end. Next slide, please, Erin. Right, fruits. Just take your pick out of the fruit which you think is best, because we are here to talk about diabetes and diet. So which fruit do you think is the best one for diabetes out of these? Yeah, okay. Yep. Yep, okay. I'm just reflecting, Adam, on all the foods that I would have selected. I definitely have got no hope. I'm definitely going to get diabetes. We'll go for the watermelon there. My favorite. Next slide, please. Now, just a bit about sugar-free. Just take your pick on the one that you think would work best for a patient with diabetes. They say to you, doctor, I have, sugar-free food, or whoever they're seeing, I have sugar-free food, and I love, what should I have? Chocolate, cake? Should I have this ice cream or cookies? They're sugar-free. Okay. I think that might be, or there's one more actually, Erin, if you just go on the last one, juices. So we've got orange, we've got strawberry, we've got kale, and we've got pineapple. Which one would you go for a patient with diabetes? Not personally. Yeah, okay. Right, brilliant. Okay. I think that's the end of this quiz. We will come back to it after we've heard from Adam. So thank you for participating. Keep those thoughts and answers in your head, and I'm going to pass it on nicely to Adam to talk to us through the diet and in a patient with diabetes. And Adam, I will keep an eye on the chat function.
Okay.
If I feel that there might be some relevance at the time, then I will just interrupt. Otherwise, I'll wait till the end in terms of the question. Yeah,
no
thank
problem.
you.
All right, hi everyone. My name's Adam. I'm a diabetes dietitian for Redbridge. So what I'll be going through is kind of the basics of the sort of stuff I discuss with my diabetic patients, because I see diabetic patients in clinic, but I also do virtual diabetes education as well, which is like an hour-long session. But so this is kind of like a condensed version of that. Okay. So first of all, with diet and diabetes, what would you like to know about? You're welcome to unmute, you're welcome to write it in the chat. I just want to know, like, what is your sort of queries, first of all?
So if you just put your questions, or if you just ask exactly what is it that you'd want covered, it would really help. Because if it's not covered in the presentation, then we can just time ourselves so we do finish on time.
For tracking.
Okay. Todd, did you mean blood markers for tracking diabetes?
So, patient also,
So we've got a question here about glycemic index versus glycemic load. And Adam, you can probably address that within the consultation. Maybe just refer to the blood test as well. Would that be all right?
yeah.
Anyone, anything else? Keep the questions coming. And what we'll do is, Adam, perhaps if we just start, and then I'll keep reminding you of the questions, if that's okay.
Yeah, sure. Okay, perfect. So in terms of NICE guidelines, the NICE guidelines basically say that a healthy diet and lifestyle is one of the most important things you can do to manage diabetes. So I know, like, once a patient gets diagnosed with diabetes, one of the first things we try and do with them is try and get them generally to lose weight, get more exercise, and have a healthy diet. But I think what the query is most people don't know what constitutes a healthy diet, because it also varies from patient to patient what sort of advice you might give. So with carbohydrates then, what are carbohydrates, which foods contain carbohydrates, and how do they impact your blood sugar levels? You're welcome to write in the chat as well, just to kind of find out what your knowledge base is at the moment.
So just for everyone, if you just put down what your understanding of carbs is, and which food contains carbs, and how do they impact blood sugar. If you want to speak, you want to come up and speak, more than welcome to.
Okay. Thanks, Catherine. Okay. All right, so I'll move on to what carbohydrates are. So carbohydrates is a food group, and it basically breaks down into glucose to provide energy for the body. So it's kind of like how I explain it to patients is, it's like if you have a car and you're filling up your car with petrol, and then basically that's what your car uses to sort of drive around and have energy for the day. And that's basically what carbohydrates are for your body as well. So when you do have carbohydrate foods, which we'll go into a little bit more detail later, it causes a rise in your blood sugar levels. So that's something we'll discuss in terms of which foods do that, how much they do that, and that will be impacting obviously some of the advice that you give to patients as well. So I'd like to show this pictures to patients. So generally speaking, when you eat any carbohydrate, whether that's bread or rice or chapati, it goes into your stomach, gets broken down into glucose, or what the patients think of as sugar. And then the sugars or the glucose have got two ways to go. One is if you're active, you kind of burn it off and it gets used up for energy, or it can just get turned and stored into fat. And one of the things with diabetes is that the more fat storage you have, the worse your blood sugars can be because of the insulin resistance as well. So, weight loss is as important in managing diabetes as well as your carbohydrate intake as well. So one of the queries that we got was about glycemic index and glycemic load. So I'll go through what glycemic index is first. So we have carbohydrates. There's many different types of carbohydrate. You have fast release, you have slow release, you have sort of sugars, things like honey, table sugar, and then you've got starchy carbohydrates, which are things like bread. And obviously you've got different categories of bread, like white bread, seeded bread, brown bread, and they all have a different impact on how they're broken down in your body. So when we say glycemic index, it basically looks at how fast or slow a food is broken down into glucose. So generally speaking, a higher GI food is something that is released faster into glucose. So for example, something like bread might take 20-25 minutes to break down into sugar or glucose, whereas something like a seeded bread might take double the time because of the sort of the fiber in it, as well as the other bits and pieces like the fats, which will slow down the release of it. So this picture here, the chart, shows you a little bit about that. So on the left, you can see if you had, for example, maybe let's say a glass of milk or a glass of fruit juice, you'll have a little bit of a spike in your blood sugar versus, let's say, you can see here also, if you had an apple. So can you see, for example, the difference between having juice versus having something like an apple juice versus having an actual apple? If you look at the charts below, you can see how it impacts your blood sugars. And that's what basically we mean by glycemic index, how fast it impacts your blood sugar. And in terms of glycemic load is basically how the total amount of carbohydrate you're eating. So when we have patients, let's say, for example, if you have a patient with high HbA1c, which is your 3-month average blood sugar, we're looking not only at reducing the GI of the food. So for example, opting more for whole grains, but we're also looking at the total carbohydrate content of the foods they're eating. So for example, the portion sizes of the carbohydrates. So glycemic load is the sort of total carbohydrate content of their diet. Out of these two, which one do you think would be higher GI, higher glycemic index?
Usually.
Think muesli?
Mm.
Okay, you're welcome to write in the chat. Okay, why do you think muesli? Yeah, so it depends on composition, that's right. So generally speaking, yeah, so muesli generally speaking has got dried fruit in it. It might even have a bit of like sugar in there, other bits and pieces which can raise not only the carbohydrate content, but also how fast it's released into glucose as well. Okay, so in terms of fruit, one of the queries I get with patients is, are fruits good, are fruits bad, how many allowed to eat? In terms of fruit, like within all types of carbohydrates, it's important to look at how much the patient's eating. So for example, I have patients occasionally who come in clinic and they're having like a big bowl of fruit for breakfast or for lunch, thinking they're doing something really, really good because it's a natural food. They don't realize obviously that fruit contains sugar as well. So with fruit, we generally say to keep it to 2 portions a day. So 2 portions would be like 2 handfuls or 2 small cups. And we also say not to avoid any certain fruit. So I have patients, for example, who cut out things like bananas because they've heard that it's bad. Do you know what bananas have got in them which can help your body in some way? Which is why it's, yeah. So Todd, potassium. So if you've got patients who are then cutting out certain foods because they think it's high in sugar, they're cutting out, certain minerals as well. So I think the most important thing to tell patients is have a variety of fruits. You don't need to cut certain ones out. What's more important is how much you have. And also try to have it between meals. Because if you have it with a meal, you'll have the carbohydrate from the meal as well as the fruit build up in your body. Whereas if you spread it throughout the day, it's like spread out more evenly, the carbohydrate content.
Not really.
Adam, can I just say there was a question about the type. I'm sorry, guys. There's a lot of background noise. If you could just mute yourself, it'd be really helpful. Erin, are you able to mute them? Because there's a background noise. Adam, there was a question about the different types of carbohydrates. Do you want to just talk a bit about simple, complex, and do you want to start?
So I probably actually should have put a slide on that. So you've got 2 main sort of food groups, 2 main types of carbohydrates. So you've got starchy carbohydrate, which are things like bread, rice, potatoes, chapati, and those ones are sort of slow released in the body. And those ones are generally the ones that you have with your meals as like part of the main part of the meal. And we talked about obviously trying to get patients to go for the whole grain version. So if you're having things like bread or pasta or rice, trying to encourage patients to have brown wholemeal versions. And then you've got simple carbohydrate, which are things like milk, honey, table sugar, and those ones are the fast release carbohydrate. So because they're simple sugars doesn't necessarily mean that you need to completely cut them out. It's just thinking about how fast they're released, because complex carbohydrates like bread, rice, chapati, potatoes, They're a little bit slower release versus the simple carbohydrates or simple sugars. Okay, so in terms of fruit, you can see here, this is the sugar content in different fruits. So you can see that some fruits in a standard serving size have got a lot more sugar than some other ones. So for example, you can see one mango, 23 grams, is equivalent to about 4 or 5 spoons of sugar in 1 cup of mango. And you can see a cup of raisins is quite similar as well. So again, it's not that patients need to cut out, certain fruits. It's just thinking about the portion sizes, because if someone had mango but they had a small cup size, obviously the blood sugar would rise more than having something like raspberries. But it's it doesn't mean that they need to cut it out. It's just looking at how much they're having. That's the main thing. So I think with patients, just encouraging a variety of fruits, but just looking at the portion sizes they have and sticking to about 2 a day. I think the other thing also to mention is to try to go for fresh fruit rather than dried fruit. So things like raisins and dried apricots, those sorts of things have got a lot more sugar because they're dried and concentrated versus having the actual apricot or grapes. Okay, with vegetables, it has a very different effect to fruits. So vegetables have got a lot of soluble fiber, which basically reduces the sort of the spike of the glucose after the meal. So as dietitians, we're always saying people to eat more vegetables, eat more salad, but people don't always understand why. And it's because this spike. So for example, I was showing you this graph before. If let's say you had a meal with lots of vegetables, your blood sugar may look more like the right, where the sugar is, or glucose from the meal is released slowly, versus if you had a meal with no vegetables, then whatever you had, especially the carbohydrate, is going to spike your sugar up a lot faster and quicker. So we always encourage people to have lots of vegetables, ideally half a plate. Okay. All right, so we talked a little bit about starchy carbohydrates, opting for whole grain. So for example, having things like porridge rather than cornflakes, which have got a lot more fiber. Same with rice, brown rice rather than white. Seeded bread rather than white bread as well. Okay, so with carbohydrates in general, we know that the whole food group raises your blood sugar. So we have some patients who become scared of carbohydrates, and they don't, I think they're scared or fearful because they don't know how much they should eat. So we generally advise around 1/4 to 1/3 of your plate. So just to give you a rough idea, you can see this picture here. So the first one is probably a little bit too small, but you're aiming for around 1/4 of the plate, which would be something like between the first and the second plate. But you can see with carbohydrates, the bigger the portion, the more glucose or sugar will be in the blood. So if you're trying to improve someone's diabetes, or they're trying to improve their blood sugar and their HbA1c, one of the main things they need to do is look at the portions of carbohydrate on their plate. The more they reduce that, the more their blood sugar will come down. I think it's also important to say that if the patient is on certain medication like insulin or gliclazide, we wouldn't advise them to cut out any carbohydrate, and any changes they make should be gradual, just so that they don't end up having any hypos or any issues. Okay, so we've also got carbohydrate foods from different, worldwide foods. So you'll see carbohydrate foods are things even chapatis, dosa, rice, moi moi, amala. So you've got lots of different world foods that contain carbohydrate. So things like fufu, pounded yam are quite concentrated in carbohydrate as well. So if you're seeing patients and you see these sorts of foods, these are quite high in carbohydrate. And these are sorts of things that they don't need to cut out, but they would need to, again, reduce the portion size to reduce their blood sugars, to improve their blood sugar. We also have protein foods. Do you know how proteins affect your blood sugar? You're welcome to chat in the group chat or say something. So proteins, yeah, it depends on the protein. So proteins, for example, like eggs, meats, fish, they generally don't contain much or any carbohydrate. So they don't really have any impact on your blood sugar, generally speaking. Things like beans and lentils have got a little bit of an impact, but because they're so high in fiber, they're not something we're generally concerned about as a main thing if you're trying to improve someone's blood sugar. So protein foods are really important in anyone's diet. I always try to get my patients to have something at each mealtime, because it's a food group a patient can eat without raising their blood sugar too much. So I always get my patients to have a small bit of carbohydrate at the mealtime and a small bit of protein. And the protein can be eggs, meat, fish, beans, lentils. If you're vegetarian, soya mince, tofu. Okay. And also with fish, trying to encourage patients to have 1 to 2 oily fish per week. Things like mackerel, sardines, salmon, to improve health as well. Also just bearing in mind, obviously, the way they cook them. So for example, if they're having things like eggs, trying to avoid cooking it or frying it, and just trying to use as less oil as possible. We also have a food group, dairy foods and alternatives. Things like milk, cheese, yogurt. I'm sure you're all aware of the benefits in terms of the calcium content for the bones. And again, it's just important to think about the lower fat versions as well, because with diabetes, as much as we're looking at the carbohydrate, we're also looking at the fat in the diet as well, because the higher the content of the fat, the more calories the diet will have, and that will encourage weight gain, which will worsen the insulin resistance. Okay. Yeah, so things like oils and spreads, if you've got a patient, a diabetic patient who is trying to lose weight, this is one of the most important things to do, to try and reduce things like oils, spreads, to try and encourage them to lose weight. Also trying to get the patient to go for unsaturated fats for their heart health as well. So for example, olive oil rather than coconut oil, margarine rather than butter, and things like vegetable or rapeseed oil. Sometimes I also find that patients get confused. So they think that because they're using vegetable oil, they can use it quite freely because it's not saturated, without realizing that oil is actually one of the highest calorie foods in the, that you can actually get. So if you're trying to get someone to lose weight, just try to encourage them to use things like grilling with like a 1-calorie spray, rather than using oil wherever possible. I know that can be quite hard in some of the traditional diets, especially things like Asian diets, but something to think about. And also thinking about the salt in the patient's diet. So especially if they've got high blood pressure. So the recommendation is maximum of 6 grams a day, but actually most of the salt that we eat is already in the food. So for example, bread, beans, crisps, things like that all already contain lots of salt. So generally speaking, we don't need to add salt to meet our requirements. So that's just something to think about. Again, it's something that is quite sparingly added to food. So we would always encourage trying not to add too much to cooking, trying to use more spices or herbs instead. This is just a little snapshot, just to give you an idea. I think this is quite useful. You're welcome to sort of take a picture of it. It just gives you an idea of which foods are carbs and protein and fats. So generally speaking, it's the carbs, the yellow and the green, that will impact your sugar level. For some reason, vegetables are in the yellow bit, ignore that, but everything else is going to raise the blood sugar. So if you're trying to get someone to improve their blood sugar, reduce their blood sugar, that yellow thing, the yellow list, is what they'll need to reduce. So cereals, the portion sizes. So cereals, breads, potatoes, rice, pasta. So things like carbs and proteins like beans and quinoa are quite good alternatives. So for example, if you've got someone who has rice, you could try to encourage them to use things like quinoa, which has got a little bit higher protein and a little bit less carbohydrate content. Also, if you've got someone, for example, who has, let's say you're having like rice and dal or rice and lentils, encourage them to have maybe a little bit more of the lentils and a little bit less of the rice. Okay. Generally speaking, also, proteins and fats, they don't really affect your sugar level in normal amounts, if they're eaten in normal amounts. So we always encourage people, especially with the proteins, to have a small bit of protein at each meal time. Okay, so here's just a picture I like to show patients, just to give them a rough idea of how their plate should be structured. And obviously this is going to vary quite a lot from different traditional diets. But it just gives you a good sort of idea. So trying to get the patient to have around a quarter of their plate as protein for their muscle strength and other things. A quarter of it as carbohydrate, and that can be rice there, potatoes, pasta, and encouraging lots of vegetables for the fiber. So this is quite a good picture I like to use with patients as well. So we have a lot of patients, for example, who think, okay, I can't no longer eat curry and rice. But actually, we try to make them see, actually, it's not that you need to cut out certain meals. It's more about how you structure it. So for example, the meal on the left has got around 27 spoons of sugar, and that's all from the rice. So you can see that the rice, if you cut the rice down to a quarter of the plate, that goes from about 27 spoons of sugar to about 8 or 9. So again, it's not that they need to cut out their foods or, they can't eat certain meals. It's just trying to encourage like the way they structure it. So half the plate vegetables or salad, keeping the rice to a quarter, and you've reduced the sugar content quite a lot, as well as the calories as well. It's gone from 1,000 calories to 410. So here's a Caribbean meal. So you can see the meal on the left has got 204 grams of carbs, which is equivalent to something like, trying to think now, bread. It's going to be about 10 slices of, no more than 10 slices of bread. It's basically around 35 spoons of sugar. So if you ate the meal on the left, it would be turning into around 35 cubes of sugar versus the one on the right, which is about 7 or 8. On the left, you can see it's the dumplings, it's a green banana, it's a yam, and they all contain carbohydrate. So something I always find with patients, they come to me in clinic and say to me, but my sugar level is always high, but I don't eat any sugar, I don't eat any cakes or biscuits. Why is my sugar level always high? And when you kind of show them these, they realize actually it's the rice, it's the carbohydrate, starchy carbohydrate that they're eating that's raising their blood sugar. So again, you can see the plate on the right is structured where you've got half of it as greens, a bit of fish, and a bit of rice. And you can see the carbohydrate content comes down very dramatically. So with Asian diets, we have some really high calorie foods, which again, it's it's difficult because obviously patients think that they need to completely cut out these foods. It's not about cutting it out. It's just thinking of them as more occasional treats. So things like samosas, onion bhajis, not only are they high in carbohydrate, but they're also very high in fat. So things like this, we don't tell them to cut out. We just tell them to reduce how often they have it. Same things with these snacks as well. So for example, you'll find some patients who are having things like the picture on the right here, the chevra, and they're having that on a daily basis as a snack. And they just need to be made aware that actually it contains quite a lot of carbohydrate, especially, and also the calories as well. So again, it's just thinking about encouraging them to have sort of alternative snacks as well. Okay. So with the Asian diets, we always encourage patients to have a little bit more beans and lentils, which have got a lot less of an effect on your sugar level. Reducing the sugary foods. So the picture I showed you earlier on the left there, that's occasional treat that they have. Again, it's not telling them to cut it out, but it's just reducing how often they have it. And also things like juices. Swapping it for sugar-free squash can have quite a big impact as well. And when they're eating things like meats and fish, curries, trying to reduce the oils in that and trying to go for leaner meats and fish rather than oily foods and kebabs and doner. Also limiting fried foods, things like samosas, pakoras, bhajis as well, and trying to encourage healthier cooking options like grilling, steaming, and oven baking rather than frying. And it can be quite difficult because traditionally a lot of oil is used. The cooking methods are not the healthiest, so it can be quite a shift to tell the patient to change their cooking methods and the amount of oil used. But yeah, it's just, you know, trying to encourage small changes at different times. So that's the end of the presentation. You're welcome to unmute, ask any questions, or ask in the group chat. Hopefully that was useful for you. It was just a brief overview of the hour-long presentation I give patients.
And that was really, really useful. We've got some questions that I might just run now, if that's okay.
Yep.
And I'm just going to say before I've been launching the questions, so one of the things that I do for the patients really, and you find when I do the diabetes clinic, I get them to just write out what they ate yesterday, and then we pick out the number of times they've had carbs. And I will just ask them which, you know, we've got to do something. So which one carb can you reduce or can you stop until we see you next time? So if you've eaten carbs 10 times a day, eat it 9 times until I see you next. But which is the one that you could reduce? And often it's the snacks, as you're saying, it's the chevros or it's crisps or some other snacks that they're having that they can actually reduce. So it's a nice way of just introducing to the concept of carbohydrates and probably try and encourage them to stop at least one because they've grown up eating that food, so to expect them to just suddenly stop, it's not going to happen. You're setting them up to fail and yourself really. So just just a tip that I use. So Adam, question here was, is sweet potato good?
In terms of the carbohydrate content, it's quite similar to normal potato. So what I would say to you is, to be honest, whichever potato they would like to have, I think it's about looking at, again, how much they're having. So a really good guide for you, and also for the patients if they have access to it, is the Carbs and Cals book or app. And it basically shows the carbohydrate content of different types of potatoes, different sizes of potatoes as well. But generally speaking, yeah, I would say sweet potato is a little bit better. It's got a little bit more fiber, but on the whole, it's quite similar carbohydrate content.
I guess it depends on the numbers you're eating. If you're going to have 5 at a time, that's probably not as good as just having the one.
Yeah.
Okay. And then there was a question here about fructose or glucose. The difference, and probably what would you say to the patient?
So for example, if they're adding it to teas and coffees to sweeten it. So in terms of fructose or glucose, those are 2 types of kind of like sugar. So fructose is fruit sugar. So fructose has got a lower glycemic index, so it generally doesn't raise the blood sugar as fast. So generally speaking, patients, have got a better effect from that if they're trying to add it to sweeten things. However, I would actually encourage them to use things like a sweetener or artificial sweetener, or even things like stevia to sweeten their food or drink rather than things like glucose or fructose, because you also don't want to encourage too much of either glucose or fructose for things like calorie reasons and other issues.
Yeah, I was going to say that while it has an effect on the glucose, the calories, it couldn't be as part of your weight loss regime as such. So that definitely. Todd, does that answer your question? Todd? That was, I think, your question there. If not, then just jump in.
Yeah, but generally speaking, like stevia is quite a good natural sweetener if they want to use as natural sweetener. But otherwise, just like a aspartame or artificial sweetener is much, much better.
Yeah, the point that I wanted to make there was that every fruit, obviously, it's a sugar as well. So each fruit has a situation on the glycemic index. So bananas are high on the glycemic index. So I wouldn't be saying to a patient, have bananas all day, because at some point in time, you're going to store that as fat. But if you're running a marathon, okay, you need a carbohydrate load to store you. But at some point, you can't store any more carbohydrates. It then gets stored as fat. So you need to have a tool to access that fat. And that's where the glycemic index comes in. The higher the glycemic index, the more chance it's going to get turned into fat over a period of time, unless it's burned by fuel in a short period of time.
Yeah, no, absolutely. Todd, point well made. Adam, do you want to come back on that one?
No, that's a good point. Yeah, I think with things like fruit, again, I just try to encourage a variety of fruit. But I wish our patients were doing marathons, but unfortunately, a lot of the time they're not doing any marathons. But yeah, so generally speaking, they generally don't need to do any carbohydrate loading unless they're doing like a very, very long walk or something like that. But generally speaking, yeah, we just encourage a variety of fruits and in small portions, 2 small portions a day.
Thanks, Adam. And the other sort of question was around the ketogenic diet.
Yeah.
Your views and what you tell the patient, because I've still got patients coming up and swearing by it.
Yeah.
For a short time it works, and then they're back to square one. But yeah, what's your take on it?
So I've had patients also do the ketogenic diet, and they've had really good results with it. So ketogenic diet, for anyone that doesn't know, is a diet that's around 30 or less than 50 grams of carbohydrate a day. So on average, we normally eat around sort of 180 to 300 grams of carbohydrate a day. So ketogenic diet is extremely low in carbohydrate, and it cuts out. So the diet is basically made of sort of proteins, fats, so things like meat, fish, eggs, vegetables. They completely cut out rice, bread, pasta, any sort of carbohydrate. We find that their blood sugars do come down quite dramatically because they're cutting all the carbohydrates out. But we also find that they are not sustainable. So a lot of the patients, I mean, I've had some patients who can stay on it long term, they do fine and they love it. But majority of patients, I find that they on and off it. And so what they'll do it for about 3 months. So it's quite a good, maybe short-term intervention. But I generally find that they find it difficult to stick to long term because of the amount of food that they have to cut out. And to be honest, you don't need to do a ketogenic diet to lose weight. So, you can lose weight on just reducing your portion sizes overall. But some people prefer to, to do it the extreme way. I think with that, it's if you've got a patient doing that, we have to look at the medication. So certain medications are not safe on a ketogenic diet. So I think it's always good for them to discuss it with a doctor or nurse before they try that. And also with the ketogenic diet, there's other things to consider, like vitamins and mineral replacements as well. So I would generally say to speak to a healthcare professional before they would try it, so they don't have any issues.
And Adam, actually, I don't know if it's on any of the evidence-based guidelines anywhere. As far as I'm aware, it's definitely not on the American, Australian, or UK guidelines in terms of managing diabetes.
Yeah.
So
it should be, because it's one of those. There's lots of studies out these days in the professional arena, which tells you how beneficial being a keto adapted is. Because obviously, the main reason why it works is because it accesses the fat stores, but you have to get a low enough carbohydrates to do that.
Yeah. So Adam, I don't know whether you want to come back, but Todd, what I'm saying is it's not featured in any of the guidelines as of yet. So it'll be really hard if it's not built in the evidence to actually say to a patient definitely would work or not. And in my experience, for sure, patients get on it, works, but actually they can't sustain it. That's the problem with the ketogenic diet. But I absolutely have seen it.
That's the problem. That's the problem with any diet, though. People go onto a diet for a short period of time, they maintain it for a little bit of time, and then they go off it because they say you get this yo-yo effect. The most important thing for me when I'm speaking to patients, I said, I want you to eat for fuel. That's what you're eating for. So if you're doing exercise that day, that's what you're actually eating for. You're not eating for because you're just eating for the sake of eating. You're eating for fuel that gives you the body the energy to do the activities and the exercise that you want to do that day. When you get into that mindset of thinking, then you change the way you think about food. You start to see it as a fuel source to support your body in its healthy operation.
And Todd, that's a nice way of putting it to your patients. As I said, each person has got their own way of dealing, and actually you've given them a nice tip today, the people that are here, on how to approach it with the patient. And I'm sure that they would find useful completely. So thanks for that tip, Todd. It's really useful.
Yeah. So there is low carbohydrate is on the guidelines. So it is mentioned on Diabetes UK guidelines as well. So sometimes I use low carbohydrate with patients, but I've never used ketogenic. I find low carbohydrate generally patients can stick to a little bit longer term, which is around 120, 150 grams of carbohydrate. So which is basically a very small portion of carbohydrate at each mealtime, around a quarter of the plate. And most patients find that a little bit more sustainable. But yeah, ketogenic diets patients have done short term, and they've had good results with it. Many of them. So.
No, thank you. And I'm just going to move on to the next question, which was about brown rice. I think you probably mentioned, but I don't know whether you just want to repeat. There was a question about brown rice. Is it good, or I can't remember the exact question. Yeah, short grain brown rice, okay?
Yeah. So again, if you look at the carbohydrate content of brown rice versus white rice, if you had a quarter of your plate as brown or white, the carbohydrate content is very, very similar. It's around 30 grams for, 31 or 32 grams for white rice, and around 29 or 30 grams for brown. So the carbohydrate content is very similar. What's different is the fiber. So brown rice contains more fiber, so it will take a little bit longer to turn into glucose or sugar. And that's why we always recommend brown. So I think I would say, generally speaking, the first point of call is to encourage whole grain brown. And second point of call is to also thinking about the portion size. So, because you'll have patients, I had patients, for example, who eat lots of, they have like 3 or 4 slices of bread, brown bread, first thing in the morning. And they think because it's brown or whole grain, I can eat as much as I want. So I think it's just sort of reminding them it's not only going for brown or whole grain, but it's also the portion size. That's really important too.
And actually, we've got some training coming up on low carb, low carb training. One of the local GPs in B&D who's got an interest in it, and she's going to be running some sessions for us with a low carb group. So that you might find beneficial as well. There's just one more question, Adam, here about, does vegetable oil have the same fat content as sunflower oil?
Yeah, the fat content is the same, generally speaking. Yeah. So with all oils, trying to go for the unsaturated, which are things like sunflower and vegetable. But again, generally cutting out oil is going to help with their weight loss. So whatever oil they're using, just trying to get them to cut it down if they're trying to lose weight would have a big effect.
Thank you, Adam. G, can I just ask, I know you posed a question about the glycemic load versus index. Are we clear? Would you like Adam to repeat?
No, that's made it really clear. Thank you, Adam. That's really good, because there's so much confusion online, and I've had patients actually come in question about glycemic load and glycemic index. And when you look at the foods that they're suggesting, there's actually some, there's conflicting evidence between the two, but I think you've just made it very easy to understand. So.
I think with the patients, I find rather than using those technical terms with them, I try to show them these sort of images to just give them an idea of portion sizes. So, just trying to keep it as simple as structure your plate like this and go for brown whole grain carbs.
Yes, no, I actually don't raise the glycemic index or because I'm a naturopath, so I think of it just as you're showing it here. They've actually come with it, so they've come with paperwork to say, well, which one should I be using? I'm like, oh, this is interesting. So,
whereas I focus on the glycemic index, because that's the most important thing for me. Because if you're looking at it, not every carbohydrate is the same. I appreciate discussion on portion sizes, which is the most important thing. But the rate the sugars enter the bloodstream is the most important thing. The higher the sugar goes in, the worse it is, basically. And if you can't store all those carbohydrates or use them as energy, then it gets stored as fat. So the focus should be on the glycemic index and how fast it's going into the bloodstream. And that, to me, is the way to manage that.
And actually, physiologically, Todd, I would completely agree, especially if they're on sort of some complex insulin regimes. It's really sometimes hard to match the insulin, and especially if they've got these high glycemic foods, that it doesn't quite match, and it gets really difficult. So I agree. I think for me as well, the glycemic index is actually one of the most important factors in terms of management. So yeah, absolutely.
And also, I think thinking about the glycemic index. So for example, if you had the meal on the left, the glycemic index is very similar to the meal on the right, because the glycemic index takes into also account the whole meal. So for example, even if you had white rice, but having white rice with some vegetables increases the fiber content. So actually it releases a lot slower. So it's not just looking at that specific food, it's looking at how actually what else are you eating it with on the plate.
But I would say you'd remove that food completely, if possible, if you could, and take it out. Because what's the benefit of rice? Honestly, it's cheap. That's the main benefit.
And tasty. But yeah, that's, I mean, that's people
Yeah, tasty if you add something to it. But
Yeah,
at the end of the day, these foods are grained that they're cheap and available, and that's one of the main reasons why people use them. If you look at different types of diets around the world,
yeah, no,
very
yeah.
different.
So definitely, but I think for patients it's really hard, especially if they've been used to having to. It's just cutting down the protein, and eventually if it can disappear, nothing like it. But in my experience, I don't think I've ever come across a patient who's been able to cut it out completely. But I'm sure you'd be able to, because obviously I seem to have slightly less time with the patients generally, but I'm sure other people managed. So I'm going to move on to the just aware, it's only 10 minutes left. I'm just going to move on to the quiz again, if you wouldn't mind, Adam. I don't know if you're controlling it or Erin is controlling.
Yeah, that's fine.
Yeah, so the falafel wrap, Adam, I'm going to pose the questions to you. We had lots of goods. Do you think this is good? If I say to you, I have that for lunch every day with a glass of juice.
With a glass of juice?
Orange juice, yeah.
Okay, so yeah, I think again, no food is bad or good. I think it's just looking at the because for example, they might be having that for lunch, and the rest of their meals might be carb free. So actually, their total carbohydrate content for the day is actually really low. So there's no specific bad or good food. It's actually just how they're eating throughout the day, also how active they are, because they might have that falafel wrap and be going for a marathon after. So again, it's just thinking about the activity levels, what their other meals are. It's looking at the overall diet rather than specific foods or meals.
And that was the point of the quiz, really, is that as long as the input and the output is much the same, then that's probably the best thing in a way. The next slide, please. Can I have it once a week, Adam?
Of course, yeah. So again, I have patients who will have this on like a weekend on a Saturday. And again, that is not going to have a huge impact on their HbA1c or blood sugar. Again, they might have that on a Saturday evening, but the rest of the week they're eating lots of vegetables, lots of, low carb foods. So again, it's just thinking about sustainability with the patient. If that's the one thing they enjoy, if they can do that once a week, they're more likely to stick to the rest of the diet the rest of the week, because they can have that cheat meal.
Yeah, and that's the treat for being good. Next slide, please. Grilled fish. If I have that every afternoon, is that all right? Or every time dinner?
So again, grilling is great. Reducing the fat content. Fish is also good, especially oily fish. It's just thinking about if you're having fish every day, I would only be concerned about maybe the mercury content as well. So that would be my only concern with having fish on a daily basis. I'd probably encourage them to have a variety of proteins. So maybe some chicken occasionally, maybe some beans and lentils for their protein, not only sticking to one source of protein.
Okay, great. And twice a week, would you recommend the fish? Yep.
Twice a week is great, yeah.
So basmati rice, American long grain, brown rice, difference? Adam?
Not really much, to be honest. I would just say to the patient, have whichever rice you have. Obviously, try to go for brown if they can. If not, have what you have. But even with the white rice, as long as you have around a quarter of your plate, not too big of a portion, you're okay.
So it's the portion size of the
Yeah.
Next one, please. Ooh, okay. So you've got fried chicken in there. You've got some fried onions in there. You've got some nuts in there. Obviously, basmati rice and bit of vegetables. How frequently can I have that?
Again, that's probably something that they would probably have as a treat, if they're going for dinner or something occasionally. So again, if they're having that once or twice a week, I wouldn't be too concerned if the rest of the week they're eating according to the plan. But if that's an every evening thing, which occasionally with some patients it can be, then I would be concerned because it's quite a lot of rice on the plate.
Yeah, so the portion size and also what's it made with, isn't it? That also important.
Yeah.
Can I have these 2 jacket potatoes for lunch every day, and would I be okay if I just stick to those 2 jackets, that one potato?
Yeah, it looks like quite a small potato. My only thing with there would also be maybe try to add a bit of protein in there. So again, it's looking at the blood sugar. If they're having that every lunchtime and their blood sugar is skyrocketing every lunchtime after the meal or before dinner, then you would be looking at, I'd be looking at reducing their portion of that potato. But if they're having that every lunchtime and their blood sugars are okay, then, I would just maybe say add in some protein as well, so to help with your reduction of appetite.
To balance that meal. Okay.
Yeah.
So this is the Jamaican meal. We've got curry goat, rice and peas, and some vegetables. I don't know, it looks like potatoes maybe on the side. Occasion, every day?
Again, it looks like quite a high calorie meal. So I would probably say, maybe twice, maybe 3 times a week, but I can't really see many vegetables or salad in there. A little bit I can, but it looks like the majority of the plate is a lot of protein and a lot of carbs. So I would probably change the balance of it to look more like the half a plate vegetables or salad.
Thanks, Adam. The next one. Ooh, my favorite. Adam, what do I do with this? I want to try and eat them every day.
Yeah. Again, it's very carb heavy. So I don't see much protein or vegetables in there again. So I would be changing, the balance of that. But it looks like quite a small portion. So it depends again, they've got some other bits and pieces with that. So it depends what they're having it with. But yeah, I would add in a lot more protein and vegetables in that as well.
So maybe just take the noodles off a bit and then just make it a bit more vegetable heavy.
Yeah.
Yeah, next one, please. Raw fish. If I want to lose weight, this is a good way of eating sushi all day, every day, apart from the mercury thing that you mentioned.
Yeah, I mean, this is quite low in calories, and it has got, it's again, first of all, it's expensive. So you have that every day, so it depends on the patient. But it's got a bit of protein, it's got a bit of carbohydrate. But again, I think, I wouldn't recommend it every single day because fish, and I'll be thinking about the mercury content again. Again, it's just trying to incorporate some other types of protein as well, not just fish in there as well.
Yep, thank you. The next one. Right, that looks like a wholesome and very tasty meal. It's got a bit of sticky rice, vegetables. I don't know how they're made. Looks like mushrooms and some noodles on the side, on the green vegetables. What do you think?
Yeah, I think the only thing missing from there is some protein. So protein really helps with reducing the patient's appetite. So for example, if they're eating quite a carb-heavy diet, they might be hungry all the time because the protein helps with sustaining their appetite. So again, I would incorporate a little bit more protein into that meal as well.
So we just last that much longer. Okay, next
Yeah.
one, please. Oh, wow. This is a Thai red curry. Often comes with rice, isn't it?
Yeah, so
creamy coconut, I think it's made of coconut.
yeah.
Cream.
So again, it's off how often they're having it. If they're having it on a regular basis, reducing the portion size of that, but also thinking about the coconut milk they use. So trying to go for the low-fat coconut milk if they're using that. Again, with that, you might have quite a lot of rice, like the picture we showed earlier. So it's just thinking about how much they're having. There might be quite a lot of maybe oil or coconut milk in there, which can increase the calories quite a lot in that one.
There's definitely no weight loss with that one.
Yeah.
Okay, then. Right, just salad, because often I get patients say, I only have salad. What would you say to them? Although it looks like a really healthy salad.
Yeah, it looks like a really healthy salad, but I'd find most of them would be hungry after an hour. So again, it's just thinking about, how realistic is it to only eat that? Because what you'll find is that they might eat that, and by the time, before they go to bed, they'll be starving. And so they'll just end up eating loads of carbs because they're trying to just, manage their hunger. So I would probably incorporate maybe a little bit of protein into there as well. And again, it might be a patient who's scared of eating carbs because they've got diabetes. So again, just educating them that you can have a bit of carbs. You don't need to completely cut it out.
And Adam, with the avocado, obviously quite good with the good cholesterol.
Yeah.
But in terms of calorie content, would you recommend an avocado a day with salad?
So avocados, yeah, they like one large avocado can have about 300 or 350 calories. So yeah, it is, healthy fats, but it can have quite a lot of calories. So again, a very small avocados you can get, they might be okay, but it can add quite a lot of calories to the meal.
Yep, lovely. Thank you. Next, and
Yeah.
we're almost there. Grilled kebab, and I hope that's not butter on top. It might be, I don't know. But if we just forget that butter on top, what does that meal look like to you, Adam? Tasty, but aside from that,
Yeah, it looks like quite high in fat and quite high in carbohydrate. So that carbohydrate portion is probably maybe around 80 to 100 grams of carbs. So that would be maybe double or triple the amount of carbohydrate you'd want to have at each meal time. And the protein again is quite a lot as well there. So again, the balance of the plate needs to change because the vegetable just looks like that one tomato. So vegetables would need to be a lot more on that
there's a
plate.
balance. Yeah. Okay, the next one, please. Oh, banana chips.
Yeah.
Lovely snacks. How many can I have?
Again, it just depends on your blood sugar, how your blood sugar is doing every day, how active you are. But that's quite a carbohydrate heavy snack as well. So if you're having lots, if you're having lots of carbs at each meal and then having lots of carbohydrate based snacks like these, then yeah, your blood sugars might be quite high. So I'd probably be looking at replacing that with other foods. So maybe even things like if you want fruit, maybe have some apricots or berries, especially if your blood sugars are high. But yeah, occasionally it's fine. I wouldn't say every day though.
Okay, next one. We're almost there, guys. Dosa, it's a pancake with lots of vegetables. There's lentils, there's rice, there's yogurt, and some chutneys. Occasionally.
Yeah, occasionally again. Again, things like that. It's a nice treat on the weekends, but
yeah,
I would, definitely not every day.
Okay, and that's a pie. I'm going to kind of move that one on actually to the fruit because I'm just conscious people now have to leave. I'll just move on to the next one because I just want to get what about pizzas, Adam? So pizzas with toppings, and that really does look like basil actually.
Yeah.
With some cheese and.
So again, it's quite high in fat, so a lot of calories in there. So there'll be a lot of calories and a lot of carbohydrate as well. So the cheese and the wheat flour will be quite heavy on the for the patient's weight as well as the blood sugars. So again, if you're having 1 or 2 slices on a weekend, again, not a problem. But if you're having that maybe 3-4 times a week, then again, that definitely would be an issue.
Yep. And the next one, please. Which soup would you recommend, Adam? Is it so you've got tomato, basil, butter squash?
Yeah, I think they're all good, but if they're having that, they again might be very hungry soon after because it's extremely low in calories and there's not much sort of fiber or protein to help maybe fill them up. Depends on a soup. Sorry, if there's some vegetable soup, maybe they could maybe add some beans or lentils or some sort of protein in there to help be a bit more filling, sustainable for the rest of the afternoon or day, whatever they're having.
Okay, and the next one, and just the next. So, which fruit? How many grapes can I have actually, Adam? Yeah.
Small cup, so it would be like a small handful. So
for fits here.
Yeah, so like a small handful. So for example, those packet of grapes you get from Tesco in the container, the plastic container, they are equivalent to about 19 spoons of sugar. So grapes can be really high in sugar. So again, it's just making sure that they're having a very small handful of them. I think the best way to measure it out is those plastic cups that you get for the water cooler. Whatever fits in there for grapes is quite a good portion size.
Okay. And all the other ones there, which fruit would you go for if you were diabetic?
Any, I would say, but again, just looking at how much, if you're having, for example, a mango, go for it. But again, just make sure it's a small cup size.
Okay. There's all the point being the portion size is really, isn't it? And the last one, I think, is the last slide on sugar-free. What's your take on sugar-free? It's not fat-free, sugar-free.
Yeah, so I've got a lot of patients who do that. And actually, if you look at the cakes, not only do they have a lot of calories, but actually, even though they don't contain sugar, they've probably got a lot of wheat in them, which actually tends to glucose or sugar anyway. So people think because it's sugar-free, they might be able to eat a lot more, but actually it's still going to affect their sugar and weight as well.
Yeah, perfect. And the absolute last one is juices. The kale juice was a favorite one for everybody when they did the quiz earlier. Would you go for that answer as well?
I would go for that, yeah. Because fruit juice in general, the reason why we use it for hypoglycemia is because it shoots up your sugar so quickly. So actually, if you're not having a hypo and you're having a glass of juice every day, that's not going to be too good for your blood sugar. And I have often patients who they say to me they have like maybe a small glass of juice every day, not realizing that how big of an impact it has. So I would recommend them to have fresh fruit rather than actual fruit.
Okay, that's brilliant. I think that was the absolute end of the slide. Are there any last minute questions? So I've got one question about, do sugar-free foods mask hypos? I can't see how. Adam, what's your view on that?
No, sugar-free foods mask hypos. No.
I can't see why that would happen, Mahi. So the answer is no. Any other last minute questions? Anyone wants to ask anything else? I'm just really conscious that we have run over time. Nope. Nothing else? Okay. So Adam, thank you ever so much. It's been really, really helpful. Certainly a good refresher for me as well. And I hope everybody found that useful. As I said, we are going to be running the low carbohydrate training sessions probably from October. So I will be in touch with that. All I would say, if the patients are on complex insulin regimes, do refer them to the dietitian. Obviously, give them early advice, not a problem, but just to try and get some dietary input as well, because they'll probably need a deep dive into the diet, etc. Okay.
All right. Thank you so much.
Thank you all, Adam. Thank you ever so much, Erin. Thank you so much for hosting, and all those also big thank you for the people that have come in. Thank you, and I hope you have a good afternoon.
Thank you.
Bye.
Bye.